Hey everyone, good evening. Dr. Charlie Johnson, physical therapist here. And just in case you don't know me, again, I'm a physical therapist and I help people heal naturally. I offer natural healing solutions for people in pain who want to avoid things like pills, injections, or surgery. So if that's you, you want to avoid any of those things, you want to go the all-natural route, then give me a call at 484-552-3767. And I'd be happy to chat and or set up a, again, no strings attached, completely free consultation to help you get to the bottom of things. That being said, in this video, I want to cover a major question that people just can't seem to wrap their heads around. So, and it's this concept that in order to help you, we actually need to, number one, know what's going on, and that we can treat you without actually knowing the source of the pain that you're experiencing. So this is sort of sparked from a question that I had from somebody in that we now know, and I sort of made the statement that images are not recommended for, and actually strongly discouraged for most everyday aches and pains, things like back pain, neck pain, shoulder pain, knee pain, for various reasons, and we'll get into that. But basically, the take home, just to cut to the point, is do not go get an X-ray MRI if you have some type of ache or pain. And I'm going to walk through that, and that most people, I get many people that come to me and they say, Charlie, my doctor told me that I need to get an image, and maybe, Charlie, I'm requesting that I get an image. I'm demanding that I get an image because I need to find out what's going on, and how do you know how to help me if you don't know what's causing my problem? So, how do you know what the cause of the problem is if you don't have an image? It's a common sort of false logic there, and we'll talk about that. And then how do you treat without actually knowing what's causing the pain? We're going to walk through that. I have notes here, so I'm referring to something because this is something that I want to make sure that I answer clearly the first time around. So first off, that sort of thought process of needing to know what's going on in order to treat the problem is operating off some old school assumptions, I'll say. And there's basically 5 of them I've written here. So number one, it's assuming that the actual cause of the pain can be found. That's the first old school assumption. Second, right, it then assumes that not only that the actual cause can be found, but that images such as x-rays and MRIs are actually like the best way to find the cause. Like that's how you do it. And that it's a necessity to find the cause before beginning treatment. And that finding, so this is number 4, finding and treating the cause results in better outcomes or quicker relief. And finally, number 5, old school assumption here, is that finding the cause results in a different course of treatment. That it's actually going to, okay, if we find that it's a herniated disc, that I'm now going to get this treatment. If I find that it's spinal stenosis, I'm going to get this treatment. If I find that I have a meniscal or a rotator cuff tear, then I'm going to get this treatment. So let me sort of debunk some of those things and talk through it clearly. So first off, what we know is that the reason that imaging is not recommended and in fact discouraged for most pain problems, and just to kind of debunk old school assumption number 1 that the actual cause of pain can be found and that x-rays and MRIs are the way to do that, is that we know that there is actually very little to no correlation between what is found on an image, such as an x-ray or MRI, and what you feel. So for example, we know that about 80% of people over the age of 50 will have some form of, say, herniated disc, arthritis, spinal stenosis, degeneration. Up to 60% of people over the age of 50 will have some type of rotator cuff tear. A lot of people are walking around with meniscal tears and arthritis in their hip, and they absolutely feel no pain. So the point is that we believe that we can pinpoint these things, but there's really no correlation there, and we can't actually differentiate what are normal age-related changes, just things that just happen, like wrinkles on the skin, balding, whatever, right? And what is actually causing your current pain. So, assuming the actual cause can be found and that x-rays and MRIs are the best way to do that has been disproven strongly at this point. So, let's see, where was I? See, I started following along and then I went off it. images alone of little value, and what is more valuable, really your story. So you need somebody who's going to listen to you, sit down with you one-on-one, hear through your problem, listen to what makes it better, what makes it worse, how it began, what your concerns are, where you want to go, what you're struggling with, and then pair that with a really good clinical or movement exam. These problems, if you have an ache or pain, it's likely that you can make it worse doing some type of movement, or you started the problem by bending over, reaching behind the car seat, doing a squat, running, some type of movement started your pain. And now you can move in certain ways that cause your pain. Well, that's a movement pain problem. So, we need to go through a good movement exam to determine what the issue is and therefore how we can treat it. And I'll get to that here in a little bit, but just understand that majority of time that people go to the physician or a specialist, unfortunately, a lot of times they don't even go through a clinical exam, what we call a clinical exam, which is basically having you move, touching your toes and raising your arm and squatting or running if you have pain only when you run or whatever it is. It might just be like 2 seconds and that's it, and then they look at the image. So they try to look at the image independent of what's actually causing the person's pain. So you can't separate the two. It's important to tie in the whole story and have somebody who can look at the picture. So that's what I do. 484-552-3767. Again, if you need help and you want to chat with somebody and help have somebody put that picture together for you. So kind of debunking myth number 3, that it's necessary to find the cause before beginning treatment. And number 4, that finding it will result in you getting better or better outcomes. So what we know is that people who get images first actually do worse. So they have worse outcomes than those who don't have an image and therefore, in the old school logic, don't know what's going on. And yeah, they do worse. So despite the best imaging techniques in the world, we have the highest prevalence of pain in the world. So like our country, right? So the old school way of thinking, we need an image and we need to go through this whole process to figure out what's going on so we can figure out how we treat it, is really sort of in the way that it's operating right now with x-rays, MRIs, things like that, the current medical model. It's just not working. So we know that people who have MRIs are more likely to be addicted to Given and become addicted to things like painkillers. We know we have a huge painkiller opiate addiction problem or epidemic in this world. They're more likely to have surgery because we know that in some cases that if people get an MRI for a back problem, they are 34% more likely to have spinal surgery because they're finding something wrong with you. They give you a label that says this is what's wrong with you, when really they probably don't actually know that's what is wrong with you. It could have been a finding that just showed up because you're 50 years old or 45 or played some sport when you grew up. Completely normal finding, but they're calling it a problem because, well, you're there and you're looking for answers. So a lot of physicians just want to give you something to go off of, and then they go down that rabbit hole of treating that problem. And what we found is that it clearly doesn't work, because we found that a lot of times back surgery is actually, people end up worse. Shoulder surgery has been compared to, as well as knee surgery, has been compared to fake surgery and found to be no better. So these surgeries are not to fix the problem, images to find the problem, then these surgeries to fix the problem are not working. And giving people pain pills to solve their pain problem because they found something wrong with them that's causing the pain doesn't result in better outcomes. In fact, now people are addicted and dying all over the world. So more risk of, if you have an X-ray MRI first before PT, more risk of painkiller addiction, surgery, and higher instances of chronic pain. So basically, to close that up, knowing, quote unquote, what's going on does not result in better outcomes, in fact, worse. So let's see. Yeah, so it's almost impossible to actually tell if what they see on an image is the main problem, right? So just take what they find, if you've had an X-ray MRI, with a grain of salt. A lot of people take it like a trump card. It walks around, they slap it on their forehead, and they walk around for the rest of their life thinking that they're screwed, right? Because they have arthritis or degeneration or some tear, and they've been stuck in the old school mindset of like the only way, and rightfully so potentially, right? Because you're going to see experts who are surgeons, and you're supposed to be able to trust and believe them. So who's to trust for these problems based off what I'm telling you if we know that the current recommendations, the current way of treating these problems is not effective? So know that there's hope and that you are not your image, all right? So, and then number 5, a lot of people think that if they get an X-ray or MRI, it's going to change the course of treatment. So if you're somewhere and you have some type of pain, wherever it may be, you want to ask the surgeon or the specialist, whoever's telling you to get an MRI, your family physician, you want to say, hey, how is this going to change the course of treatment? So let's just say, create a scenario out of it. Let's just say I find that I have something wrong with my shoulder or my knee or my back or whatever. How is it going to change what happens next? And the truth of it is that 9 times out of 10 we'll review when it might, but even more than that, 99% of the time, 9.9% of the time, it's going to result in you going back to PT, or whatever you want to call it, needing education and exercise, all right? Now, with that being said, right, the only time that you should get an X-ray or MRI for an everyday ache or pain is basically, I'll say, 1 of 4 times. So the first time is if there's concern of some type of tumor or cancer, right? And there are different, and PTs are well trained to kind of understand what those signs are. I won't go through them all in this video, but understand that if we think there's concern of cancer or tumor, then yeah, we're going to want an X-ray or MRI. If there's concern of some type of fracture, there are signs of that. And there are things that make us think that that could be part of the problem. If there's a concern of some infection in the bone or in the body or something like that. And or if there's some type of major problem or damage to your nerve. This just doesn't mean that you feel some tingling going down your arm or you feel some weird feelings, into your buttock, some zapping pain down your leg into your foot. That just means the nerve is irritated. It doesn't necessarily mean that you're losing strength or you're losing feeling, right? So major damage to the nerve would be that you're losing strength, so you're dragging your foot, you can't pick things up, you're dropping things, or you're losing feeling. Like literally, you poke yourself with a pin and you can't feel it. Those are signs of not only the nerve just being irritated, but the nerve is unhealthy. And yeah, we're going to want an image there because you potentially, that might be a reason for a surgical route. So again, that's not common though. And again, the cool part about going to see a PT first is that we're well trained to screen for all of these things, and then we can adequately refer out. And think of it like this. So PT, people are all caught up on like, the doctor told me, and even physicians, makes no sense. The doctor told me I need to go figure out what this is first, and maybe you watching this, or maybe somebody you've talked to has said, hey, don't go to PT until you get an X-ray MRI because you really need to find out what's going on. Hopefully you understand so far why that isn't an effective and is not the best route. But a lot of people think that going that route is going to result in something different. And they think that that's the smartest, quickest path to relief, when in fact they could have already started with PT. So here you are, you enter the medical system, you go to your primary care physician, then you have to wait a little bit to see the specialist, and then the specialist needs to take a while, you get an X-ray MRI, then you need to review the X-ray or MRI, then you're going to have a follow-up visit to figure out what to do about it, and by that time, all this time, and meanwhile, this whole time you've been in pain, has built up. So you're still in pain and you've taken this much time. If you just have a pain problem and you go right to see somebody, PT, least invasive, no side effect type treatment, low cost, super simple, and helps the majority of people with these problems first, well then you're going to cut to the chase, right? So so get this. It's like going straight to surgery is sort of like this. So let's just say I'm making this up off the fly. Just say that you're driving down the road, whoop, whoop, the lights turn on, and it's a traffic stop. You get pulled over, right? And usually there's like 1 or 2 cops there. I think now it's like you have to have 2 policemen there, police officers, for backup or something like that. But the point is now imagine that, whoop, whoop, you get pulled over, you pull on over, and like 20 police officers pull up, they throw out the spike strip, the SWAT team comes running around, right, stick them up, and I mean, you're just going to be complete shock. You can be like, hey, like, this is overkill, dude. Like, my tail lights out or whatever it is, right? So that's sort of like going to surgery first. It's calling the SWAT team, bringing in like all the big guns for something that doesn't need to be done. It's not a good use of resources. It wastes, a lot of people are putting time and energy into that when you could have just had like one or two officers there and they could have solved the problem perfectly fine. So that's PT, right? We provide like a cost-effective cost-effective. So the best results for really the least utilization of resources or costs there when it comes to these pain problems, all right? We don't need to pull out the big guns like pills, injections, or surgery. They make a lot of money on the back end. That's another sort of political issue, but they don't result in better outcomes. So don't call the whole SWAT team. Go right to just be happy with the one or two officers. Go right to PT first. So that being said, healthcare is backwards, right? So yeah, people are entering here thinking that they need pills, injections, surgery first, and the images, and then they're going to least invasive options. Versus if we could flip that on its head, people who get PT first save money, do much better, are educated during this whole process, and learn to take control and are empowered to manage their own pain problems. So a super effective way to go there. And this goes to the next part of the question. So the first part of the question, if I think back to this, was, well, how do you know what's going on? And we just talked about how you really don't have to know what's going on, and you can't really always find out what's going on. Sometimes you can, and sometimes there's concern of needing to find out what's going on, but the majority of the time it's not. And then it's like, all right, so if we can't tell what's going on, then how do you treat it without actually knowing what's going on? So the first step is just like I said, when you come to see a physical therapist, right, we can sort of screen out those things to make sure, first off, should you even be here? Should you even be treated by a physical therapist, and are you appropriate for that treatment? Meaning, like, we have to screen out and make sure it's not something big and ugly, like I talked about, a cancer tumor, a fracture, infection, some type of significant and worsening damage to the nerve. Again, losing strength, feeling, whatever it is. So we go through a good clinical exam to determine that, and then we sit down and we have the most amount of time out of all other healthcare providers to really listen to your problems. So we're in a really good spot to pick up a bunch of things because we give you the time to share your story. And we have the training to make sure, first off, you're appropriate to be here. It's nothing big and ugly, and that's our first priority and our first job. And then after that, it's like, okay, if this is a movement problem that brought on this pain, and certain movements now can make the pain better and worse, well, then we need to establish that movement-pain relationship. So, if you can establish a relationship between anything, you can often break it up. So, for example, if I know that if I turn on the light, I can almost always turn off the light. If I can turn on the water, I can almost always turn off the water. If I can turn on the pain, I should be able to figure out what turns off the pain. So you can figure out what that relationship is, learn about it, study it, and then break it up such that movement no longer equals pain. So how do we determine this? We go through a detailed history. We kind of audit your injury and go through the whole process there, listen to where you want to go, and then look at actually what's causing you pain to determine, hey, when you do it this way, what happens? And when you do it this way, what happens? Okay, this makes you feel better. All right, then we can utilize that potentially. Oh, and this makes you feel worse. All right, well, then we need to educate you on how to tweak or modify that so you're not doing that all the time. So, yeah, the combo at the end of the day, right, is really simple if you think about it. Think of pain as your alarm system. Something sounding the alarm for whatever reason. It could be a disc, it could be a joint, it could be whatever. Who the heck knows and who cares? But at the end of the day, we need to figure out if you've got a frown face and a smiley face, all right? Sort of on a seesaw here. Picture it's teetering, right? What you'll notice is that a lot of people, if you really think about that movement-pain relationship and getting in touch with your pain, what you'll see is that often people are very quick to say, this is what makes my pain worse. Charlie, I can't sit, I can't drive, I can't lift overhead, I can't squat, I can't run, whatever it is. And they've got this whole laundry list of things. But it's really hard a lot of times for people to feel out, to kind of think about or come up with ideas of what makes it feel better. Usually it's like, well, I take some Advil, or I do this one stretch, or I put some heat on it, and there's like a few things compared to all of these things that make it feel worse. So you can imagine if that was a seesaw, right? You've got 1,000 pounds of things, a very heavy side of things that make it feel worse, and very few things that make it feel better, right? So the first step in healing a pain problem without actually determining the cause, because we know that we can't exactly, as long as we know it's not something big and ugly and it's a movement pain problem. And then how do we know how to treat it if we don't actually know, quote unquote, the cause? Well, we listen to that movement pain relationship and we learn about it. If we have an environment where you're doing a lot of things that are making you feel worse and one or two things that are making you feel better, first off is education. We have to figure out how to unload the side that's making you feel worse. And you can do that two ways, right? You can unload it by doing less of what makes you feel worse, such that it goes right like this, or you can grow, and then, so that's the first step. You got to unload that. So you're minimizing the weight on the side of what makes you feel worse, right? Now you have a more level or more optimal balance there as far as healing. And then what you need to do is you need to couple that. So step one is education, unload it. And step two is that you need to find specific movement strategies, as we discovered in an exam where we were having you move, bend, twist different ways, right? Such that then you shrunk this side, so it's like this, with the education, and then using movement strategies, you can grow this side. I don't know, my whistle and my whole movement was off there, but you get the concept, all right? So I don't even know if I'm going to try to do that again. So it's like unload it, shrink it, put out the fire, do less of that which is making you feel worse, create a more optimal healing environment through number one, education. Then number two, you want to grow using movement strategies, exercise, whatever. Movement is medicine on this side, such that then you can really make the better side heavy and you can tip the scale to healing. So quick summary there. Imaging, strongly discouraged and not recommended for the majority of everyday aches and pains. Therefore, and the reason is because there's little to no correlation between images and what people feel. So people who are told they have all these abnormalities, really that could just be a lie. How do you actually know that that's the cause? Because so many people have these problems and feel no pain. So how do we determine, well, that was there 5 years ago, and then this was here yesterday, and it doesn't have a timestamp on when these problems started and what's going on. Instead, the best examination, if this is a movement problem that caused the pain, then the best examination is one that brings you through a bunch of different movements and teaches you about that relationship, such that you can break it up. You no longer associate movement with pain, and you can do less of that, which is making you worse, right? And more of that, which is making you better, using movement, education, and movement, such that you can find natural relief. So there's a lot of myths there. The old school assumptions, you don't actually need to search, and it's actually wasteful use of time, energy, and other resources to search and try to find the cause of your problem. It's not going to result in a different treatment per se, or in the majority of cases. Images are not the way to find the cause. That's an old school way of thinking. It's not necessary to find the cause, and finding the cause does not result in better outcomes and does not change, again, the path or the course of treatment. So I think that's it. I think I've gone on long enough. Hopefully that was valuable. Again, I'm looking at my notes here because this is sort of something that's really hard for people to wrap their head around. They just don't understand how somebody like myself, who doesn't actually know, who can't look in at the problem, right? A lot of these problems, like paper cuts, you can look and you can actually see something's wrong with you, right? But when it gets inside the body, the back, the neck, the shoulder, everyone, like old school, like, man, I got to get an x-ray or I got to get an MRI to figure out what this is. And the truth is that it has just led to people becoming worse because they're told they have all these problems wrong with them, when in fact it's just normal findings. Now these people, then these people are just led down a slew of unnecessary treatments based off a faulty abnormality, which was probably just there to begin with. and it's just a racket. So I know it's really hard to wrap your head around potentially if you're watching this, that you need an image, X-ray, MRI, whatever, to find the problem, and that you must know before you begin treatment, and that nobody can help you unless they actually know what the root cause is. But I'm telling you, and trust me on this, that, and the evidence shows it, that is just, again, a very old school sort of mentality, and it's completely not true. It's been well disproven at this point. So with that being said, if you're looking for a complete movement exam, you're not even looking for that. Nobody ever said, I want a movement exam. The point is, you're looking for natural relief, and you want to get to the bottom of your pain problem, and you know that you have a movement that causes your pain, and you want somebody who's sort of an expert in reasoning through. This is not just like, hey, do these exercises. This is reasoning through a problem, right? A complicated problem, often known as pain. So, if you're looking for that, call 484-552-3767. Would love to chat with you, help you out, set up a completely no strings attached, no obligation, free consultation there to help you out and get you on your path to natural relief. 484-552-3767. Have a good night, everyone. Thanks. Oh, and if you have anybody who needs to hear this, like, share, comment below. Could use your help getting the word out about these things. All right, there's a lot of people out there addicted to painkillers, getting unnecessary images, which is leading to painkillers, injections, and surgery, and then they're no worse, or they're no better, and or a majority of the time they're actually worse thereafter. So if you could just take 1 second, hit the share button, would appreciate it. Thanks.